Warriors around, don't get caught in the mosh pit. Fuel to the fire, ain't nobody can stop it. Trouble in my city, but you know I'm across it. Got a 40 on my hip and I'm liable to spark it. Throw down these hits, my click is indivisible. I aim, you duck, I squeeze, now you invisible. I'm not afraid of getting physical. All these different chemicals are fogging up my visuals. Bloods on my hands, got slugs on my gunners. Yo, we notorious, we ain't no runners. Bloods on my hands, got slugs on my gunners. Yo, we some warriors, they ain't called gunners. Bloods on my hands, got slugs on my gunners. Bloods on my hands, got slugs on my gunners. Put on my sweat, put on the beat, put on the map, put on my team. Take out every motherfucker in between. Know what I mean? Better myself, better my aim, better my rap, better my name. Killing rappers on my hang on by their chains for the fame. Never thought I would, now I'm running. You don't wanna follow me, now I'm looking for.
What's going on? What's going on? Good afternoon and welcome to another broadcast of Steve the Kidney Nurse. And I'm your host, Steve Belcher. Thanks for joining. Look, the topic tonight that I'm going to be talking about is almost a spin-off from last night. Last night, if you was here, I talked about diabetes and foot care. What you need to know if you had diabetes. And tonight is no different. Tonight I'm talking about diabetes or diabetic retinopathy. You're like, Steve, what the hell are you talking about? Diabetic retinopathy. Why are you using such big words? Like, what is it? Let me tell you something. If you're watching this right now, I want to thank the TikTok crew for tuning in. And the one person that's watching on either Facebook or YouTube, thank you. Because, see, this information is valuable to a lot of people. Because so many people deal with this. In fact, let's look at what the statistic says. More than 37 million people, 37 million people in the U.S. have diabetes. And I have right now 49 people watching from TikTok. And any one of them may have diabetes watching this. In fact, 1 out of 3 of them will develop, of the 37 million, 1 out of 3 will develop diabetic retinopathy. But first, let's talk a little bit about diabetes and vision loss. Diabetes can damage your eyes over time and cause vision loss, even blindness. That's why you can't sit back and you got diabetes, you had it for 5, 10, 15 years, and just because nothing hasn't happened yet, and maybe it may not, and maybe it will, but just because something hasn't happened yet doesn't mean it's in the future. Because we know research shows if you're not managing your diabetes and you're always having high sugar levels or glucose levels, 300, 400, then each time your levels are going up, it's doing damage. You don't see the damage but it's behind the scene. It's insidious. But there is good news. If you're watching this and you got diabetes and it hasn't happened to you, there is good news. And the good news is managing your diabetes or eradicating it out of your life if you got type 2 and getting regular eye exams can help prevent vision problems and even stop them from getting worse. So let's talk about some of the eye diseases that can impact you if you got diabetes. Some of those eye diseases that can affect people with diabetes include diabetic retinopathy. And I just had one person on TikTok say that they had the next one, macular edema or macular degeneration, which usually develops along with diabetic retinopathy. Can develop cataracts and even glaucoma. All can lead to the road of vision loss. But early diagnosis and treatment can go a long way toward protecting your eyesight. That's why if you got diabetes, there's certain things you need to do to make sure that you're okay. Because at the end of the day, you don't want any type of damage to your feet, your eyes, your heart, your kidneys, all behind diabetes. That's why people be talking about this. Again, 1 out of 3 of the 37 million people that have diabetes will develop diabetic retinopathy. You keep hearing me say that, Steve, what's diabetic retinopathy? Get to the point. Well, diabetic retinopathy is a common disease, and it's the leading cause of blindness in working age adults. Now, let me tell you how this happens. So, if you got diabetes and you had diabetes for a long time and it's been uncontrolled, like, now I don't give a damn. I want to eat, do whatever I want. And then next thing you know, you driving or doing something, you start seeing some fireworks out the side of your eyes. Or these black floaters. Like, what's going on? What's the hell going on with my vision? So, diabetic retinopathy is caused when high blood sugar, that's the key, high blood sugar, damage blood vessels in the retina. And I had it up on TikTok. Let me put it back up. So again, this happens. Diabetic retinopathy is caused when high blood sugar damages blood vessels in the retina, a light sensitive layer of cells in the back of the eye. Damaged blood vessels can swell and leak, causing blurry vision or stopping the blood flow. Sometimes new blood vessels grow, but they aren't normal. They're not normal. It can lead to further vision problems. And diabetic retinopathy usually affect both eyes. That's why you hear some people say that I gotta go to the eye doctor and get shots. Oh, they gotta go get this done or that done. They gotta get laser. This is not something you want to play around with. So let's look at some risk factors. Let me take this off. Let's look at some risk factors for diabetic retinopathy. Anyone, and I mean anyone with type 1 or 2 or gestational diabetes, which is diabetes while pregnant, can develop diabetic retinopathy. The longer you have diabetes, that's what I'm saying. You don't want to have no diabetes 5, 10, 15 years. You don't even want to have it 2 years, 1 year, if you can help it. Now, again, if you got type 1, you can't do nothing about it. But manage it the best way you can. But type 2, we know type 2 is preventable in some cases. You got some people who take medication that transplant medicine that may cause them, because the medicine may cause them to have diabetes type 2. But anyway, if you got type 2 diabetes or type 1, you're at risk. And again, the longer you have diabetes, the more likely you are to develop diabetic retinopathy. And these factors can also increase your risk. Blood sugar, blood pressure, and cholesterol levels that are high. That's why we tell you, stop. You got diabetes. You got to watch what you eat. You got to watch your saturated fats. Because diabetes and heart disease are linked together. That's why you got to watch your blood pressure. And also watch your blood sugar. Smoking is a risk factor. If you're minority, Hispanic, Latinos, African Americans, as they call it, Indians, Alaskans, are at higher risk. Now, I urge you and strongly suggest, if you're watching this broadcast right now, it ain't many on TikTok, numbers went down. That's okay. But if you got diabetes and you're watching this right now, and you think you may have diabetic retinopathy, you may want to go and see an eye doctor, ophthalmologist, maybe get some low vision aids such as a magnifying glass, some special lenses to help. And you know, with diabetic retinopathy, there's stages to this. So just like kidney disease, there's stages. And so the earlier you catch it, the better you'll be. I know this must be, born time. You got Saturday night and, where's the excitement? But what you going to say if you got one of the 37 million people watching this right now, whether it's in real time or after this broadcast is over? What are you going to do if you start having vision problems and not knowing that you got diabetes. And the next thing you know, your vision quality is low. Hell, it could get to a point where you can't even see the screen to watch TikTok. Nobody wants to lose their vision. But if it's preventable, and if you're at risk for it with diabetes, and you never heard of diabetic retinopathy until tonight, then you need to keep learning about your condition to prevent further complications. Because once TikTok is banned, if that happens, then what? Then when you going to get your information in real time? Like I said, if they close TikTok, you can catch me on the Clapper. Now, I haven't went live yet over there, but I'm prepared. Or you go to my YouTube or Facebook channel. But the information doesn't stop. So, again, make sure you subscribe to my channels, because if you're dealing with kidney disease or diabetes or hypertension or some type of chronic illness that leads back to kidney disease, and you don't know what to do, and they close this platform down, or they close TikTok down, it ain't gonna be no more, oh, I can go to such and such page and watch them on home dialysis, or go to such and such page and watch them doing PD. So be prepared either way. So let's talk about the stages of diabetic retinopathy. Because again, the earlier you catch it, the better. And so diabetic retinopathy has 2 stages. Just 2. It ain't 5 like kidney disease. It's 2 stages. So that means a whole lot of time to react. The early stage, also called the non-proliferative stage, the blood vessel walls in the retina weaken and bulge. We talk about tiny blood vessels. And then they form in tiny pouches. You won't be able to detect them, but your eye doctor can. When you go do that, your annual vision check, these pouches can leak blood and other fluid, which can cause a part of the retina called the macula to swell. Macular edema, and distort your vision. Now, I don't have diabetes, but 2 years ago, I had a torn retina, 2.5 to almost 3 years ago. And I can't tell you the anxiety of having that blurry vision, not able to see the television or seeing the blur. I can't tell you the anxiety I went through just for that low vision loss. So I can't imagine having both visions in both eyes reduced. And so macular edema is the most common cause of blindness in people with diabetic retinopathy. Let me repeat that. macular edema is the most common cause of blindness in people with diabetic retinopathy. And about half of people with diabetic retinopathy will develop macular edema. And all this leads back to the high glucose or high sugar. Now let's talk about the advanced stages. Proliferative. In this stage, the retina begins to grow new blood vessels. These new vessels are fragile and often bleed into the vitreous. That's the clear gel between the lens and the retina. With minor bleeding, you may see a few dark spots that float across your vision. I saw that. Irritating as heck. See these little stringy floaters going across your field of vision. Now, if there's a lot of bleeding, your vision could become completely blocked. Like what's going on? That's why eye exams are extremely important. If you don't walk away from anything else from this broadcast and you got diabetes, make sure you get an eye exam. Now, you may not even notice symptoms in the early stages. That's why it's very important to get a dilated eye exam at least once a year. Again, a dilated eye exam at least once a year to catch any problems early when treatment is most effective. A lot of people catch a lot of this stuff. It's too late to do anything about it because they didn't know. And that's why I do these type of shows, as I repeat again. So if you don't know about it and you happen to run across this broadcast and you find out you got diabetes, or if you do and you never heard about it, no one mentioned it to you, then now you can do something about it. So let's look at symptoms in the advanced stages. Let's look at what those symptoms look like in the advanced stage of diabetic retinopathy. Symptoms can include blurry vision, spots or dark shapes in your vision, or called floaters, trouble seeing colors. That's why if you work in dialysis, they want you to do a eye exam or eye color test to make sure, because a lot of the stuff in dialysis is color coded. Dark or empty areas in your vision. And then vision loss. These are all symptoms in the advanced stages of diabetic retinopathy. Now, how is this diagnosed? How do they know you have diabetic retinopathy? So during your eye exam, the doctor would check how well you see the details of letters or symbols from a distance. You know, the eye exam. Then the doctor will also look at the retina and inside your eyes and may use a dye to reveal leaky blood vessels. Now, if it turns out you have diabetic retinopathy, your eye doctor may want to check your vision more often than once a year. Now, you should be checked for diabetic retinopathy immediately if you're diagnosed with type 2 diabetes. And that's what I said. And I didn't even read this far. Once you find out you got diabetes, because you don't know how long you had it. You don't know if you could have had it 6 months, a year. You just get now diagnosed. And so the damage could have been happening behind the scenes. So again, if you're watching this and you find out that you just got diagnosed with type 2 diabetes and you notice some changes in your vision and you hadn't connected the dots, I just connected them for you. Go get checked. This is nothing to play around with. You can ask a lot of warriors out there who go to multiple appointments every year to see the eye doctor. Now, again, you should be checked for diabetic retinopathy immediately if you're diagnosed with type 2 diabetes. Now, if you have type 1 diabetes, you should be checked within 5 years of your diagnosis and then regularly thereafter, typically every year. And that's if you have type 1. Now, the sooner you're treated for diabetic retinopathy, the better that the treatment will work. It's not something you sit and wait and think it's going to disappear. In fact, the longer you sit around and wait, the worse it may get. Okay, we're talking about little capillary blood vessels. So if you're watching this on TikTok, if you're watching this on Facebook or YouTube, either now in real time or you're watching the broadcast replay, call your doctor if you notice any changes in your vision, especially if they happen suddenly. Now, these changes may include blurring, spots, flashes like fireworks, blind spots, distortion, and difficulty reading or doing detailed work. Now, when I had a torn retina, just happened out of the blue. Wasn't doing anything strenuous, just driving. Next thing I know, inside of my peripheral vision, I'm seeing fireworks. I'm thinking it's the street lights. Like, what's going on? Then when I get home, See the same thing. I was like, what's going on? Kind of ignored it a little bit. Then next thing I know, my vision started getting blurry. And you talking about somebody going ape, you know what? Went down the emergency room. I couldn't even get seen at first. And it wasn't for the Krieger Eye Institute in Baltimore at Sinai Hospital. Dr. K. Can't pronounce the last name. It's called a Dr. K. Definitely hooked me up, and now I'll go down and get my eyes checked. And I don't even have diabetes. Just found out that I have some cataracts. Again, I don't have diabetes. Guess it's with my age. They say I'm 58. I may not look it, but I damn sure feel it. So even myself, I have kidney disease stage 1. I can't slack off of this. So let's talk about treatment. If you have diabetic retinopathy, let's talk about the treatment for it. Now, treating diabetic retinopathy can repair damage to the eye and even prevent blindness in most people. But you gotta catch it early, guys. Treatment can start before your sight is affected, which helps prevent vision loss. Now, here go some options, and there's many. That's why the sooner, the better. Excuse me, let me turn back on the green screen. Okay, the sooner the better. Now, these options include laser therapy, also called laser photocoagulation. Now, this creates a barrier of scar tissue that slows the growth of new blood vessels. Then you got medicines called VEGF inhibitors, which can slow down or reverse diabetic retinopathy. Okay? Then you have removing all or part of the vitreous, also called vitrectomy. Then you have reattachment of the retina. For retinal detachment, a complication of diabetic retinopathy. And then you have what a lot of people go do is the injection of medicine called corticosteroids. Get the steroid shots in their eye. And so let's get into a quick look at other eye diseases, okay? That center around diabetic retinopathy. Cataract. You may have heard, you may see people say, I had to go get cataracts removed, and they had the dark glasses on. So a cataract is the clouding of the normally clear lens in your eye. It's the clouding of the lens. So through everyone, lenses tend to get cloudy as they get older. So as I was telling you, let's say I had some cataracts. People with diabetes are more likely to have cataracts and at a younger age. You see, if you got diabetes and you're young, you're more likely to get cataracts when it's supposed to happen at an older age as you get older. Now, one reason is that high blood sugar can cause deposits to build up in the lenses and make them cloudy. Now, other risk factors for cataract include high blood pressure, having obesity, and too much sun exposure over time, and smoking. Now, surgery is the only way to treat cataracts. So at some point, your boy is going to have to get surgery. But you usually don't have to have surgery right away. Using brighter lights in your home and anti-glare sunglasses outside can help early on. And then if the cataracts get in the way of doing everything activities, then that's when it may be time for surgery. Now, the good news is the surgery is very safe and most people have better vision afterwards. Okay? Now, let's talk about another common problem with this. Glaucoma. Glaucoma, a lot of people may not know or even heard of glaucoma. But yet, if you're one of the 37 million people with diabetes, you need to listen up about glaucoma. Now, glaucoma is a group of eye diseases that damage the optic nerve. Usually because pressure in the eye. And many types of glaucoma don't have symptoms. That's the scariest part. There's no symptoms. And vision loss can happen so slowly and insidious that you don't even notice it. You don't even notice it. Next thing you know, your vision is gone. So people with diabetes are twice as likely to develop open angle glaucoma, the most common type. Other risk factors include having a family history of glaucoma. So that means if your mother, your father had diabetes and dealt with this, you're more likely to have it and deal with it. Also, being over the age of 60 and being African American, Asian, Hispanic, Latino. Now, diabetes can also cause neovascular glaucoma. Now, this happens sometimes with diabetic retinopathy when new and abnormal blood vessels grow on the iris. And that's the color part of the eye. The new vessels can block off the flow of fluid out of the eye, which raises eye pressure. You see how this works? Now, there's no way to prevent glaucoma. Okay? Can't go out and buy any drops or anything to prevent this from happening. But treatment can help stop it from getting worse. That's why catching glaucoma early is so important. And that's why doing these type of shows is so important, because if one never heard of glaucoma or haven't even thought about it and they walking around with diabetes, now they can go get checked. Now, treatment options include medicines, laser treatments, and surgery. So talk to your eye doctor about what choices are good for you. Because you don't want to go walking around untreated. And the next thing you know, you're losing your vision. I met a lot of warriors that lost their vision behind glaucoma. So let me give you some tips to prevent or delay eye diseases. Now, you can protect your vision and lower your chances for vision loss with these steps. Get a dilated eye exam at least once a year so your eye doctor can spot any problems early when they're most treatable. Don't wait around. 2, keep your blood sugar levels in target range as much as possible. Over time, high blood sugar not only damages blood vessels in your eyes, it can also affect the shape of your lenses and make your vision blurry. See, I want people to see, I have up on TikTok picture of inside the eye. You see the vessel, because you can't see this when the damages is happening. Okay? Three, keep your blood pressure and cholesterol levels in your target range to lower your risk for eye diseases and vision loss. Again, you don't want to walk around here blood pressure 200 over 120, 210 over 110. Sometimes you see people with these high blood pressures and they may come into dialysis and they may have a bleed in their eye. And you can see it. And that's no fun when you have a bleed in your eye because it's blocking your vision. So again, keep your blood pressure and cholesterol levels in target range. That means keep your blood pressure below 140, 120, if you can. Hell, 110. Keep your cholesterol below 200. If you smoke cigarettes, quit smoking. Quitting lowers the risk for diabetes-related eye diseases and improves your health in many other ways too. And get active. Don't just sit at home watching me or other TikTok creators. Get outside. Get some physical activity, because physical activity protects your eyes and helps you manage diabetes. See, if you manage the diabetes, then it can manage lowering the blood sugar, which in turn will not affect your eyes. And last but not least, get your eyes checked. Eye problems are common. I repeat, eye problems are common in people with diabetes. But treatment can be very effective. Now, only the eye doctor can diagnose eye diseases. So don't be walking around, you see something going on, you trying to self-diagnose yourself. Only the eye doctor can do it, or the ophthalmologist. So again, make sure you get a dilated eye exam at least once a year. Just once a year. And find out what's going on with your peepers. The earlier eye problems are found and treated, the better for your eyesight. And I cannot stress that. I cannot stress that. I met so many people in my career that said, Steve, I wish I knew. I didn't take it serious. Now, let me repeat again. If you are living with diabetes and you're watching this right now, it is important. Hell, it's critical to prevent vision loss, because diabetes increase your risk for vision loss. As I mentioned in the beginning of the broadcast, more than 37 million people in the United States have diabetes. And 1 out of 3 of them will develop diabetic retinopathy. The leading, not the second, but the leading cause of severe vision loss and blindness among working age American adults. Now, you can read this on the internet yourself. But how many people are going around even thinking about vision loss and diabetes if they don't even know that they have diabetes in the first place? And that's why you need shows like this. You need people like me to remind you of what's going on. You need that person, that voice of reason. Now, as we finish off this broadcast, the only thing that I can say, if you're watching this and you have diabetes, type 1, type 2, please, if you haven't already done so, go get a dilated eye exam and just find out where your eyes are at if you haven't done so within the last 5 years. That's our message to you for tonight. Because we don't want to see anyone, not one single soul, lose their vision if they didn't have to. And with that being said, thank you for watching this broadcast. And tune in tomorrow morning or tomorrow at noon, 12 noon, Eastern Standard Time, to see another episode of Kidney Hub East Africa with myself, Steve the Kidney Nurse, and the Kidney Ambassador, Moses Kennedy, as he'll be broadcasting from Nairobi, Kenya. And then later tomorrow evening at 7 p.m., tune in for another episode of Kidney Disease Education Moment, as I'll be talking what's a health researcher. So tune in tomorrow, starting at 12 p.m. Eastern Standard Time. Thank you for watching. Take care. Have a great evening, and God bless. Peace.
Warriors around, don't get caught in the mosh pit. Fuel to the fire, ain't nobody can stop it. Trouble in my city, but you know I'm across it. Got a 40 on my hip and I'm liable to spark it. Throw down these hits, my click is indivisible. I aim, you duck, I squeeze, now you invisible. I'm not afraid of getting physical. All these different chemicals are fogging up my visual. Bloods on my hands, got slugs on my gunners. Yo, we notorious, we ain't no runners. Bloods on my hands, got slugs on my gunners. Yo, we some warriors, they ain't called gunners. Bloods on my hands, got slugs on my gunners. Bloods on my hands, got slugs on my gunners. Put on my sweat, put on my beat, put on the map, put on my team. Take out every motherfucker in between. Know what I mean? Better myself, better my aim, better my rep, better my name. Killing rappers on my hang, I'm by their chains for the fame. Never thought I would, and now I'm running. You don't wanna follow me, now I'm fucking